I'm Jansen Wolf. I'm 24 and I came to Dr. Fisher for a breast reduction. The first time that I walked into Dr. Fisher's office, I felt nervous. And the second I talked to the receptionist, I felt very comfortable, very recognized, very welcomed. When I was brought back into the office, I was sat down and just felt very comfortable with all of the people that you work with.
I think sometimes patients will tell me that the office feels a little bit like a spa. It feels a lot less like a medical office.
Yes.
So you feel very comfortable because it's not clinical.
No, it's a beautiful space. It's very welcoming, very warm, much warmer than any other doctor's office. You're offered something to drink. You're made to feel very welcomed. So I really enjoyed that. I didn't feel afraid of anything. I didn't feel, sometimes you get this very antiseptic type, very hands-off, very cold feeling in a doctor's office. You don't feel that at all walking into Dr. Fisher's office.
I designed it to feel a little bit like a living room.
Exactly.
Like you're coming to visit me at my home, like if you were a family member and you came over just to sort of talk about what was important to you privately.
Yeah.
And I've set out the rooms so that it's a private experience, that when you're in the waiting room and you come back, that you really don't see anybody else and you don't see other patients, that people checking out don't see the people checking in.
Exactly.
There's a private exit, so that it's very much a private experience, very comfortable,
very smooth,
very discreet. Tell me about your education. Let's just talk a little bit about you.
So I was lucky enough to do a history degree for my bachelor's, and then I accepted an offer to study my master's in England to do international relations. I was very lucky and fortunate to do that.
And hardworking.
It was a lot of hard work, but it was a wonderful experience. And I'm now fortunate enough to be back in the States and have my master's degree. And while I was doing all of that, I didn't have the time to have a surgery that I'd wanted for a long time. When I was about 14, my breasts started to develop, and they just kept developing and got a lot larger than I ever expected they would, to the point where I had a lot of back pain. I was constantly hunched over. I didn't like the way that clothes fit by the time that I was all the way through puberty. It's difficult as a young woman to be very different from all of your peers at a young age, and then as you get through college and into graduate school, you're always the girl with the very large boobs. And I was not comfortable being labeled as such, because as I've told Dr. Fisher before, I have a lot more to offer the world than just the way that I look. I enjoy the fact that I'm very educated, and I'm very lucky that I've been able to do all of that with my life. So it was time. When I finished my master's, I'd known for a couple years that it was what I wanted to do. And so I decided that I was going to find a surgeon and discuss having a breast reduction and no longer being the girl that was constantly labeled and constantly, looked at, people looking at my breasts rather than my eyes, and not being taken seriously in a professional setting. So I was just ready.
I've heard that story from other patients as well. It is unfortunate and an uncomfortable experience to have conversations in which your body features are a focal point for the person you're speaking to. It's distracting.
Very much.
And also I've heard many patients say that it can be challenging to find the right clothing, or that the clothing malfunctions, that buttons open in the front, or you have to wear a shirt that's so many sizes bigger, which then doesn't fit your body.
No, and as a woman, you want shopping for clothes to be a fun experience. You do it with family, you do it with friends. And when I was growing up in college and graduate school, it was not a fun experience at all. It was uncomfortable, and I never walked away feeling satisfied with what I'd found, And as a woman, that's not it's not the experience you want to have.
And then imagine going to the pool or
exactly. No,
going to exercise.
Exactly. Oh, I mean, we're talking like 2 to 3 sports bras to work out in.
And you're active?
Exactly. Very active. I love to work out. I row. I've rowed since college. And I remember rowing in college, I had to wear 3 sports bras in the boat, and you're the only girl in the locker room that has to do that. And taking off 3 sports bras after a sweaty workout is not a fun experience.
So what was your size before?
I was a 32 G before all of this, and I am much smaller now, which I'm very happy with. So
yeah, I think you're very proportionate.
Yes, exactly.
And your breasts are age appropriate, proportionate to your body.
Exactly. They've been lifted. Before I had before the breast reduction, I had quite a lot of sagging. They were much heavier, much further down my actual chest, and now they are much more lifted. The nipples are, in line where they're, supposed to be. We've talked a lot about that, it was I'm so pleased with the results. I really am. Yeah.
I'm glad.
Yeah.
I'm so
Of course. Glad. My first memory of Dr. Fisher was something that's probably pretty unique. We talked about British history, which is something that we're both very passionate about. It's what one of my degrees is in. And she just made me feel very comfortable. She made me feel cared about as an individual, as a person. She was very interested in who I was, interested in what I wanted to do with my life, interested to hear my entire backstory. We had a very long first appointment, which is rare with a doctor, with a surgeon. I felt listened to, which was unique. And yeah, my first memory of you is just very warm, very welcoming, very, very kind.
I'm so glad.
Yeah.
Every time I meet a patient, I like to spend the time to get to know who they are and what their lifestyle is like and what's important to them. Yeah. I think that's really important to be able to communicate. You really need to understand something of who the person is.
Yes.
And for the patients to feel comfortable really talking to me and sharing with me, I think they need to understand how sincerely interested I am in them and what they need.
Definitely.
And always with patients, I'm thinking about their safety and then, finding a plan that's going to fit their lifestyle and they're going to heal well. And then I finally want it to just look really great. And so the awesome result always is going to have to pass the safety test.
Yes.
Be a safe plan that should heal well, and then I design it to have a really artistic, proportional result. But none of that can happen until you really understand the person and what's important to them. And so I really enjoy talking to people. I like the patients.
Definitely.
I like to connect with the patients, and I feel kind of in my heart, I feel like that each patient that I care for is a family member, and I'm taking care of someone who I understand and care for like a family member.
I would recommend you to friends and family and literally anyone that I met, because you're an incredible surgeon. You care about your patients. You care about more than just getting it done and doing cosmetic surgery. You care about us each individually. You spend your time with us. Your work is impeccable, honestly.
Thank you.
It really is. I was so pleased. I had this vision of terrible scars and botched surgery and things like that, because you see TV shows, you hear horror stories, things like that. You see really bad photos. You can hardly see my scars. I'm 2 months post-op. You can hardly see my scars. And they feel great. They feel natural and full. Everyone that I've that I've shown has been very happy. And it's, you worry a lot. So I would recommend you, because your practice is wonderful. You're made to feel like a human, not a patient. You're cared about, and your work is just amazing.
Well, I'm very grateful that you let me take care of you.
Oh, of course.
I think
it was my pleasure, honestly.
Well, it's my pleasure. I feel a gratitude to each patient that allows me to be their doctor, and I take that very seriously. So I'm very grateful that you let me take care of you and let me try to help you get to the result that you were looking for. I'm so pleased that you're happy with the shape and the look, and I appreciate you taking the time to talk to us.
You're very welcome.
Thank you.
You're very welcome.